So here we are with Dr. TJ on to talk about hypercure and how you basically incorporate this into your practice in Chicago. Pretty popular procedure?
Yes, I almost do now 2 to 3 cases every week. Hypercure has been a big part of my practice past several years. That all these misaligned feet with symptoms, patients been treated just for the symptoms but not the cause. And then some patients already know about hypercure through my website, but also most of the patients, they don't know about it. They're not aware of this underlying cause, and then they get surprised. So my big part of my practice is to educate my patients about this wonderful, minimally invasive, takes less than 20 minutes, this procedure to patients, so that they realize these kind of procedures are available. And then another issue also with the insurance company, a lot of patients get discouraged. So I make this procedure affordable, and then also I work with a lot of other third-party financing companies to make this possible to get this procedure done without worrying about insurance companies.
Dr. Michael E. Graham actually developed the hypercure 13 years ago, and it's actually available in 60 countries, which is pretty amazing. So, but it's still like the best kept secret here in the United States, which is, I'm sure, very frustrating. And is that why you guys started the Foot Alignment Institute together?
Exactly. That's exactly why we co-founded FAIAHN, Foot Alignment Institute, because a lot of doctors not adapting these procedures, and then our mission and my life's mission in coaching and teaching other healthcare professionals. So not only I help my own patients, but also help other doctors to help more patients in their practices.
I know, and this procedure, I'm very proud to say I'm a podiatrist, and being a podiatrist is a topic very near and dear to my heart, because we kind of get into that mindset of procedures, and to fix misaligned feet, it's a pretty aggressive surgery. We're talking about cutting, we're talking about fusing, we're talking about weeks of rehabilitation, and there's no going back. That's it. And so with the hypercure, 20-minute procedure, minimally invasive, you can do kids as young as 3 up to about the oldest patient, 94.
Yeah. So I have some patients already have some kind of aggressive fusion surgery done on one foot, and then they come realize there's a procedure hypercure available, and then they see usually the big difference in recovery period, how fast they heal compared to more aggressive, cutting bones and putting a lot of screws and plates, versus hypercure procedure really looks like a screw, but it really goes to the empty space between 2 bones, and then that realigns the whole alignment of ankle to knees to hips and back.
We could talk about this forever, but you know what? I think you have some great testimonials. So let's toss those testimonials and listen to some actual patients who are benefiting from this amazing procedure.
So we first learned about Dr. Ahn and hypercure through a TV special, and I came here because I've had flat feet my entire life, and so I've always had feet pain, hip pain, knee pain, shin pain, all day long from whatever kind of shoes that I wear. And so learning about this procedure, it was an easy thing that I wanted to sign up for, and I said right away that this is something that I was interested in without hesitation. I always had this dream of having the perfect arches, and with this procedure, that is exactly what I found. I've been able to wear any kind of shoes now without any type of problems. And so that has been life-changing for someone who really enjoys shoes. I'm able to walk and run and move around quickly without having any type of discomfort. At first I was really hesitant because I was so used to having the discomfort, but now I realize that I can trust the arches that I have and trust my new feet to give me that freedom.
I had severe pain in my feet and my ankles, walking longer than an hour. It inhibited me doing any kind of long-term activity. I couldn't do any kind of walking for exercise. I had severe spasms in my back, and my knees started to turn inward, so I started to have pain in my right knee. At my age, you probably would expect that because I was born with this, and I never had corrective shoes or anything. I tried all kinds of over-the-counter orthotics and those kinds of things, but they helped a little bit, but they didn't really take the back pain away or anything like that. So, you know, my foot is getting so much better now. It's really, I can tell that it's coming along, and I'm really excited to not have all this pain and be able to exercise and walk and bike and do whatever I want to do so that I can feel better. And I never related it to my flat feet. I never knew. And since I've had the right one done, just since then, my spasm is gone from my back, and my knee is starting to, I don't have any pain in my knee at this point, in my right knee. It wasn't difficult at all. It was less painful than getting a filling in my tooth.
What great stories, Dr. Ahn. That must make you feel so good as a physician.
Yes, they definitely do. And I want this kind of reward for not only for surgeons but for their patients as they help their patients through these wonderful procedures. That's why I think Atlas Foot Alignment Institute, it will help not only patients but a lot of other healthcare professionals.
Okay, so if you're a patient out there, if you're a physician wanting to learn more about this procedure and how you can learn how to do this procedure and add it as part of your toolbox in your practice, what's a good place where they could go to?
Simple, atlasfai.com.
Sounds great. There you have it. Check it out.